Imagine your body's a bit like a street, right? And you've got these two neighbors just constantly causing a ruckus.
Okay, neighbors.
Yeah, neighbors. So one, let's call him the liver,
Hmm.
is always accumulating clutters. Piles of greasy takeout boxes, half-eaten tubs of ice cream,
Hmm.
just making a real mess inside.
Uh-huh. The messy neighbor.
Exactly. And the other one, blood sugar, they're throwing these wild, unpredictable parties at all hours,
Mm-hmm.
spiking energy levels, then crashing them down.
Ah, the noisy party neighbor. Got it.
Totally. And they're constantly disrupting the peace, making life difficult, not just for each other, but like for the whole internal neighborhood.
Well, that analogy is quite striking, actually, because this isn't some quirky one-off scenario, is it? It's playing out on a massive scale within India.
Right.
We're genuinely seeing this twin trouble, as some experts are calling it. You've got type 2 diabetes, that's your unruly party host.
Okay.
And then you have metabolic dysfunction-associated steatotic liver disease, or MASLD, that's the chronically messy neighbor.
MASLE, formerly ANSLE.
Right. Precisely. It's been rebranded. And it's not just a minor concern, it's becoming a huge challenge affecting, well, countless lives.
Absolutely. And it seems it's reached a point where India's top medical experts have actually gotten together. They've drafted a new set of guidelines.
Yes, like a neighborhood charter to try and restore some order.
Exactly. It feels like a really significant step, these guidelines. They were published recently, aimed specifically at the situation for Asian Indians.
And it's badly needed. MASLD, as you said, used to be an AFLD. It's now the #1 cause of chronic liver disease globally.
Wow. Globally.
Globally. And the situation in India is particularly pronounced depending on the specific group you look at. The prevalence ranges anywhere from, say, 27–28% up to a staggering 88–89%.
That wide a range.
Yeah.
That's huge. It really shows how widespread it is.
It does. It speaks volumes.
So who on our metaphorical street is most likely to get caught in the middle of this neighborly feud?
Well, the risk jumps dramatically if someone is already dealing with obesity or type 2 diabetes or, other metabolic issues.
How dramatically?
We're talking something like 52–53% likelihood of also having RSLD compared to maybe 28% in the general population without those conditions.
Okay, so they really do travel together.
They absolutely do. They tend to amplify each other's negative impact.
And this isn't just about, like, feeling a bit off after too much junk food, is it? This liver mess and the blood sugar chaos, they're actively making each other worse.
That's the core of the problem. It's a vicious cycle. Diabetes becomes harder to manage when MASLD is present.
Right.
And perhaps even more concerning, ASLD significantly boosts the risk of serious heart problems, cardiovascular disease.
Which is already a leading cause of death in this population, isn't it?
Sadly, yes. So, you see, while we start by talking about the liver and blood sugar, the consequences ripple outwards. It's a full body issue.
You keep mentioning Asian Indians specifically. Why is this such a big deal for this particular group? Is there a genetic angle?
That's a really crucial point. There seems to be a genetic predisposition in Asian Indians towards storing more fat in the liver.
Even at lower body weights?
Exactly, even at weights that might be considered perfectly healthy according to, say, Western standards. It's like the liver's tipping point for fat storage is just lower.
Okay, I see.
Now, you layer onto that the extremely high rates of type 2 diabetes in India. We're talking over 77 million adults.
77 million.
Yeah, so you have this large population segment that's particularly vulnerable to this dangerous interplay between liver fat and blood sugar problems. It's a uniquely challenging combination.
It really paints a picture of a serious public health challenge.
Yeah.
It's good to see experts like Dr. Anoop Misra stepping up. He chairs Fortis CDOC, doesn't he? And he's got quite the reputation.
Oh, absolutely. Dr. Misra is a leading figure. He's received the Dr. B.C. Roy Award, the Padma Shri, highly respected.
Right.
And he's described the situation perfectly, calling it a dual epidemic, where each condition just fuels the other. His leadership in getting these guidelines developed is so important.
So, given there's already global advice on diabetes and liver issues, why the need for these specific tailored guidelines for Asian Indians? What was missing?
That's a very good question. The thing is, global recommendations often don't fully capture the nuances of how T2D presents in Asian Indians.
Okay.
nor do they always account for that unique metabolic profile we just discussed, the tendency for liver fat even at lower BMIs.
And lifestyle factors must play a role too.
A huge role. Dietary habits, diets often high in fried foods, sugary drinks, combined with more sedentary lifestyles.
Mhm.
These contribute significantly in the Indian context.
Right.
So having guidelines developed by experts from places like AIIMS, Sir Ganga Ram Hospital, Medanta, it means they're grounded in the specific realities faced in India.
Okay, that makes sense. So we've got the background, the twin trouble, the need for these guidelines. Let's get into the specifics. What are the key takeaways? What should people and doctors be focusing on?
Well, one of the absolute fundamentals is proactive screening. The guidelines are really clear. Screening for MASLD in everyone with type 2 diabetes,
Everyone.
everyone with T2D, but especially those who also have other signs of metabolic syndrome or are carrying excess weight. They need regular checks.
And what does that screening involve initially? Is it complicated?
No, not at first. It starts simple. Things doctors can easily measure. BMI, waist circumference, waist to height ratio. These basic markers can flag potential issues early on.
Okay, simple flags first. But if those flags go up, then what? More specific tests.
Exactly. For those who need a closer look, the guidelines suggest using the FIB4 test.
FE4?
Yeah, it's a calculation based on routine blood tests. It gives an estimate of liver fibrosis or scarring.
Okay.
And then there's liver stiffness measurement, often done with a special ultrasound like FibroScan. It assesses the liver's health non-invasively.
Right.
Dr. Misra really emphasizes looking at the whole picture, though the clinical evaluation, including cardiovascular risk, because it's all so interconnected.
Identify early, assess further.
Got it.
What's the next big pillar in the management strategy?
Weight loss. Without a doubt, achieving weight loss is highlighted as a primary intervention
For both conditions.
for both MSLD and T2D. Even, modest weight loss, 5%, 7%, can make a really significant difference in reducing liver fat and improving blood sugar control.
But they stress sustainable changes, not crash diets, right?
Absolutely. The focus is very much on sustainable, realistic dietary modifications. Fad diets are generally discouraged because they're just not maintainable long term.
So what does that sustainable, liver-friendly, diabetes-conscious diet actually look like according to these experts?
They recommend a balance, roughly 50-60% of calories from complex carbohydrates. Think whole grains, lentils, chickpeas, lots of vegetables.
Okay, good carbs.
Exactly. Then about 20-30% from healthy fats, so monounsaturated fats like olive oil, canola oil, plus polyunsaturated fats from nuts and seeds.
High protein.
Around 15-20% protein. But crucially, the advice is to really minimize added sugars, refined carbs, white bread, maida products, sugary snacks, and also saturated fat.
Which are often high in processed foods, and many traditional fried items are sweets.
Precisely. Those are the areas to really cut back on.
What about India's large vegetarian population? Do the guidelines offer specific advice there?
Yes, definitely. They actually positively highlight well-planned plant-based diets. Diets rich in legumes, nuts, seeds. These are great sources of fiber, plant protein, healthy fats.
So vegetarianism can be very suitable here.
Very suitable. And for non-vegetarians, the advice is to include fatty fish, like salmon or mackerel for their omega-3s, but limit red and processed meats.
Okay, now, here's one that caught my eye. Coffee. Is there really a benefit?
Yes. It's quite interesting. The guidelines do mention that consuming more than 3 cups of caffeinated brewed coffee daily seems to be linked with some protective effects for the liver.
Like what?
Research suggests it might help improve liver enzyme levels, potentially reduce fat buildup in the liver, and maybe even lower inflammation.
Brewed coffee, though, and presumably without loading it up with sugar.
Absolutely key. Adding lots of sugar would likely cancel out any potential benefits, but yeah, black brewed coffee seems potentially helpful.
That's good news for coffee lovers.
Yeah.
What about the other big lifestyle factor, exercise?
Exercise is non-negotiable, really. It's considered essential.
What's the target?
The goal is 150 to 300 minutes of moderate intensity activity per week.
Like brisk walking.
Brisk walking, jogging, swimming, cycling, anything that gets your heart rate up, or alternatively, 75 to 150 minutes of vigorous activity.
And this helps with both liver fat and blood sugar.
Yes. Regular activity is vital for reducing overall body fat, including liver fat, and it significantly improves insulin sensitivity, helping with blood sugar control.
Okay, let's talk cooking oils. This is huge in Indian cooking. What do the guidelines say?
This is a really critical point. They specifically highlight the potentially harmful effects of saturated fats found in ghee, coconut oil, palm oil, butter.
And trans fats in processed snacks.
And trans fats, yes. These can really contribute to fat buildup in the liver and inflammation. They also caution against repeatedly heating cooking oils.
That's a common practice, isn't it? Reusing oil,
It can be, and it degrades the oil, creating harmful compounds. So the recommendation is to switch towards oils high in monounsaturated fats.
like olive oil or canola.
Exactly. Olive, canola, groundnut oil used appropriately, and also being mindful of overall omega-6 fat intake, trying to keep a good balance with omega-3s.
Got it. And for someone who actually has MASLD, what's the verdict on alcohol?
It's a clear and simple message: no alcohol. Complete abstinence is recommended.
Even small amounts.
Even small amounts can put extra stress on an already vulnerable liver and make things worse. So for MASLD patients, it's a strict no.
It's worth reiterating that this isn't just one person's opinion. This comes from a serious collaboration of experts.
Absolutely. We mentioned Dr. Misra leading it, but he worked with Dr. Ashish Kumar from Sir Ganga Ram Hospital, Dr. Mohammed Shafi Kuchai, and Dr. Narendra Singh Chaudhary from Medanta, Dr. Neville K. Vikram from AIIMS Delhi.
All big names in diabetes and liver disease.
Right. Leaders in their fields. Their goal was to create a practical, evidence-based framework that doctors across India can actually use day to day.
So, pulling it all together, what's the bottom line? Why is taking this twin trouble and these guidelines so seriously, so vital? What happens if it's ignored?
Well, the stakes are really high. If MASLD isn't addressed, it can progress. It can lead to cirrhosis, serious liver scarring,
Which can lead to.
liver failure, liver cancer, potentially needing a liver transplant down the line. And as we keep saying, it dramatically increases the risk of heart attacks and strokes.
So these guidelines are basically a roadmap to try and prevent those really serious outcomes.
Exactly. They offer a crucial tool for both prevention and management.
It sounds like while doctors have a big role in screening and guiding treatment, there's also a lot individuals can do themselves.
Oh, definitely. That's a key message. These guidelines empower people to take more control. It doesn't have to be massive, overwhelming changes either.
Like what sort of small changes?
Simple swaps, maybe choosing dal or a vegetable curry instead of a paratha sometimes, building in a 30-minute walk instead of spending that time sitting,
And talking to your doctor.
and proactively talking to your doctor about your liver health, especially if you have diabetes or other risk factors. Open communication is key.
So the idea isn't to see these guidelines as some, like, strict auntie telling you off.
No. Think of them more like a helpful, knowledgeable, maybe slightly cool cousin.
Okay, I like that.
Someone who wants to help you enjoy life without your liver causing major drama down the road. It's about being mindful, making conscious choices most of the time.
And if you slip up occasionally, have that extra gulab jamun.
That's normal, that's life. The focus isn't on perfection, it's about awareness, making generally healthier choices, and getting back on track. Being mindful of the potential liver drama before maybe overindulging too often.
It really feels like these guidelines could be a starting point for a bigger shift in India.
I think so too. They're a vital first step for increasing awareness, pushing for better screening, and encouraging healthier lifestyles across the board.
It takes everyone, though.
It's a collective effort. Patients, families, doctors, healthcare systems all need to work together.
So, to leave our listeners with something tangible, what's one small thing someone could consider doing today, right now, based on all this?
Well, maybe brew that cup of black coffee we talked about, if it suits you, of course.
Okay.
And maybe decide to go for a short walk later instead of scrolling on your phone. Just a small step, incorporating a bit more movement. It's about taking that proactive approach, informed by this kind of tailored advice, that can make a real difference.
Great advice. Making those small, informed choices for your long-term health.